So my name is Pundrique Sharma, and I'm a consultant plastic surgeon based in Liverpool and the northwest of England. So as with a lot of cosmetic surgery, there are no specific factors that really make someone a very bad or very good candidate for surgery, assuming the patient is generally well and doesn't have a serious medical problem that prevents them having surgery. The most important thing is that the surgeon and the patient have a good rapport, I think. And that sounds silly, you would think it's to do with a medical, physical shape of the patient or the technical abilities of the surgeon, but actually it's not. And the reason for that is, firstly, generally speaking, people are happy when they work with people they trust. Right? That's just true in any walk of life. Secondly, if you have good communication, you can understand each other in terms of what you expect. You as a patient have an expectation of a result. I as a surgeon have an idea of the parameters in which around which I can put to say, hey, these are the sort of results that you can get. So I would say that it's not the characteristics of the patient, but the nature of the relationship between the doctor and the patient that makes the relationship a good candidate, if that makes sense. When you want a breast reduction, the primary problem most people have is volume. And I think there's kind of an idea that very often you can do liposuction. Liposuction by itself generally doesn't work, but for a couple of reasons. The first reason is that your breasts are not just fat. They have a lot of glandular tissue in them, so it just won't remove everything that you would hope it would remove. The second thing is that usually with large breasts, you have a certain degree of sag, and that sag is just not corrected with liposuction. In fact, even if it worked, you'd end up with more empty looking sagging breasts, so it would be worse. So in general, it's a breast reduction surgery that sort of does what it says on the box. And that involves, whenever you do it, it always involves scar around the nipple. Usually, almost invariably, one at least vertically below the nipple. And then most of the time, I think in breast reductions, you also end up with a scar running in the crease just underneath the breast. So it looks like an anchor. That's the commonest scarring pattern. And that is basically the option you have. And you can augment it by doing a bit of liposuction or something. But the primary thing is a breast reduction operation, a reduction mammoplasty. So there's two basic groups of advantages you'd get from having breast reduction surgery if it's the right thing for you. So the first is improvement of symptoms. So a lot of women who have it, like they get pain in their shoulders, they can feel the drag. It can be bad for their posture, difficulty sitting straight and standing straight particularly. And so that's the first thing. That's a very common complaint. But the second thing is an aesthetic thing, right? They don't like how they look in clothes. They don't look how they look out of clothes, and they feel embarrassed and awkward. And it can certainly address both those factors. I guess that overall, though, when you put them together, usually you can improve the patient's confidence and just general well-being. It's great to see people after the surgery. They look different. It's very odd. They stand differently. It's very, as with a lot of this surgery, very satisfying to see the positive effect it can have. Yes, there are disadvantages. There are disadvantages to any surgery. And risks, absolutely. And I think probably the thing that I think most about is the scarring, because there is, as I mentioned before, scar around the nipple, down and underneath. I'm always surprised by how little it bothers people. I suppose the scars are usually pretty thin scars, but nonetheless, I think that it's very clear that usually people who come to this point have such great disadvantages in terms of how they feel, the pain, the discomfort, how they feel about themselves, the advantages far outweigh the disadvantages for them. So yes, absolutely, they can alter the results. Is your breasts are made up of fat, so losing and gaining weight firstly can alter the size of the breasts. So you really want to therefore be at a point when the weight is stable, ideally. It's also a case of proportion, right? How your breasts look, whether they look good or bad, is very much dependent on how the rest of you looks. So if the rest of you looks slimmer, you might want breasts that are smaller. And similarly, if the rest of you is slightly larger, you might want the breasts to look larger as well. So it always looks in proportion. And the other thing to think about is that actually breasts are hormonally sensitive. And as you change weight, if you change the weight significantly, particularly, hormone levels can also alter, all affecting the results of the operation. So I think in general, it's a good idea to be at a very stable weight before you have surgery and not to be changing. Now, the only exception to that, I suppose, or one of the exceptions to that, is when people are trying to lose weight and they're trying to exercise, but they can't because the breasts are stopping them doing it. And if you say, okay, you can't have surgery till you're stable, you put them in a catch-22 where they feel they can't exercise and because of their breasts, but until they do exercise, they can't have it. And in that case, you have to think, okay, well, maybe the best thing to do actually just to go ahead and accept that risk. Yes, absolutely. It can. So if your asymmetry, for example, is in part due to volume difference, which it often is, then one option is to reduce the volume of the side that's too large, and you can do a breast reduction in order to do that. And with regard to the lift question, well, yes, actually, the technique that we use to reduce breasts is very similar to the techniques that we use to lift breasts up. And in fact, there usually is an element of lift in breast reduction. It's very, I can't think of any time I've done it where it's not been an element of lift with the breast reduction. And really, when you compare the two techniques, as I say, very similar, but just in one case, you're focusing on volume, that's breast reduction. In the other case, you're focusing on the sag, which is a breast uplift. But there's an element of crossover between the two.